A 35-year-old male with no significant medical history presents for a routine health checkup. He reports being generally healthy and asymptomatic, but his chest radiograph, conducted as part of the screening, shows an unusual finding. The chest X-ray reveals a hyperlucent area in the left lung field, which appears hyperinflated. The patient denies any respiratory symptoms and has no history of chronic lung disease. What is the most likely diagnosis for the radiographic finding in this patient? A. Pneumothorax. B. Bronchial atresia. C. Pulmonary embolism. D. Tuberculosis. The correct answer is B. Bronchial atresia. Bronchial atresia is often an incidental finding on a chest radiograph in asymptomatic individuals. It manifests as a hyperinflated or hyperlucent area due to unidirectional airflow through collateral channels like the pores of Kohn and canals of Lambert. The condition often goes unnoticed as it does not connect with the tracheobronchial tree, thus typically avoiding infection and remaining asymptomatic. Diagnosis can be particularly suspected in the absence of symptoms and confirmed via CT if the presentation is atypical. This fits the patient's profile and radiographic findings perfectly, distinguishing it from other. Though other conditions such as pneumothorax can also present with hyperlucency, those usually have accompanying symptoms such as sudden chest pain and shortness of breath, which are not reported here. Pulmonary embolism and tuberculosis typically have additional clinical presentations and do not primarily exhibit hyperinflation on chest radiographs.